going live. Hey guys, welcome. It is the best part of our week. This is Let's Talk NCLEX. This is Monday Motivation. I am really excited today. We are coming back to ReMar Nurse University. ReMar Nurse University is back. And what is so awesome about this, if you've ever experienced ReMar Nurse University, it is our opportunity to go over the most important NCLEX topics. And usually I go over a lot of different topics, but we are only concentrating on pharmacology. Like, do you guys understand? Like, this is huge for me as an NCLEX instructor because I was challenged by you guys. I got a comment on Instagram. And one of my nurses, I don't want to say the same things as you guys are hearing other places. And then I was in this lecture just really quickly, and an NCLEX instructor was instructing the class, and students said, "Can you help me with pharmacology?" And the instructor was like, "Yeah, you got to know the top 100 drugs on NCLEX." And so the student was like, "Well, what are the top 100 drugs on NCLEX?" And the instructor said, "You got to Google them. Just Google them." That was literally the answer. And so I wanted to just scream because you guys know where you can find the top 100 drugs on NCLEX. Quick facts for NCLEX has the top 100 drugs on NCLEX. But her answer was just to Google it. Oh my goodness. And so it blew my mind, and it said, and I said to myself, I got to do pharmacology this year. So we are going to do pharmacology for you guys. And then also, if you are in the virtual trainer during RNU, you will see the bonus material that we will be putting on in that NCLEX comprehensive program. And so I'm so excited. I want you guys to be able to sign up for it. It is totally free. Remember, whenever we do ReMar Nurse University, the entire month that we do it, it is a gift to you guys. So you can go ahead and sign up. remarnurse.com/RNU. And by doing so, it will put you in the loop for ReMar Nurse University. You'll be able to get all the announcements, the schedule, everything. Also the workbook, because you got to have your workbook. You got to have your workbook. And I'm going to just tell you, it's beautiful. I'm working on it now. It's beautiful. So I'm going to love it. Hey, how about we talk about the things that we're going to be reviewing at RNU this year? Pharmacology focused. We're going to talk about the nervous system medications. And I wanted to start with this topic because honestly, pharmacology, everybody struggles with. I'm so serious. And so I know the nervous system medications are difficult. We're going to talk about pain management as well. And these are things that I want to hone in on to make sure that you guys understand it. But this is not all. I'm also studying with ReMar. Is this the same thing that I'm seeing in the virtual trainer? No, absolutely not. Everything that I will be presenting to you guys, I have challenged myself that it would be new information. It would be supportive information. I am going to tell you the story of pharmacology so that at the end of these topics, you guys will be so fluent that if you get a question on the nervous system, or if you get a question on, these are other topics I'm talking about, TPN, all right? Also antibiotics. And these are fundamental pharmacology. These are fundamental pharmacology topics that you just have to know. All right. And so these are the things that we will be talking about. All right. Check it out. Check it out. And blood and blood products. Okay. So this review is going to be so important to you guys that are taking your NCLEX exam. This review is going to be so important to you all who are taking this exam. All right. And, I just want to say, all right, that I am really excited for this program. I'm really excited for this program because pharmacology again is really one of those topics that you need. It will begin May 18th, okay, through June the 8th. And the way we do it, is we're going to do it every Monday. All right. Every Monday during this time period. And so if you guys sign up for it, this pharmacology review, okay, this pharmacology review. And so if you need help, if pharmacology is your area of weakness, ReMar Nurse University, you don't want to miss it this year. We are fundamentally changing the game. And I like topic with full lectures is going to be monumental. It will essentially just change the way you look at these medications. And so I'm challenged, and I thank you guys for the comments that said, hey, we want to study something different. And just hearing, the nurse instructor tell the student that you need to Google this information. It was like, oh my gosh, that's so crazy. All right. So right now, we are going to go over some topics. I'm so happy we have 6,800 people in the virtual trainer. All right, 6,800 people in the virtual trainer. And it is like, man, mind-blowing. So we're going to go into the first topic right now. And of course, I'm doing pharmacology. So here is the NCLEX. Here's the NCLEX question for today. And here's the NCLEX question for today. It says, which of the following forms of alternative medicine works on the principle to address imbalances of energy flow? All right. Imbalances of energy flow. Is it number 1, chiropractic medicine? 2, holistic medicine? 3, homeopathic medicine? 4, Ayurvedic medicine? 5, acupuncture. Okay. And so these are the topics that we will be going over. So if you're doing this and you're like, wow, I really didn't study this, let me tell you, you need to know this for NCLEX. So I'm going to be so excited to break each one of these down for you. I want you guys to be here because you will get a preview of what we will be studying for ReMar Nurse University. And this is not a select all that apply question. This literally is you have to pick one. All right, you pick one. All right. And so the correct answer here is yes, it's number 5. Each one of these medicines are considered alternative medicines, but number 5, acupuncture, this is traditional Chinese medicine, and it is a balancing of energy flow or life force, okay? And so I had a really great time preparing these topics for you. I'm really looking forward to you guys getting your workbook and being able to fill out this information with me for the lectures. Our Eve client who is prescribed intravenous morphine for pain. Which assessment finding is the highest priority? Okay. Is it number 1, oxygenation saturation of 94%? 2, respiratory rate of 11 breaths per minute? 3, client reporting pain 8 out of 10? Or 4, client is difficult to arouse? Okay. All right. What do you guys say here? This is opioids. We will be going in depth into what you need to know about the opioid medications. And if you do have quick facts, you can study this information before ReMar Nurse University, but you are going to really feel supported once you hear the full lectures. Okay. So a lot of people are picking 2. Which I am, I'm interested in. I'm interested to see that. Is there a different answer? I see a couple different answers. I knew I would get you with this one. Number 4, more of a priority. And the reason why is because if you have a client If you have a client with a respiratory rate of 11, well, you know that the client got an opioid. So you expect those respirations to come down, right? So you have a client with a respiratory rate of 11, you're watching that client. But if you have another client who is difficult to arouse, they have a decreased level of consciousness, who's going to be able to maintain their ventilations? Is it somebody who has a respiratory rate that you can count? Or is it the person that is not waking up when you call them? All right. They're not easily aroused. And so we have to be able to identify the safety issues, because NCLEX is all about safety. And you can dress up distractions to make them look very good. Okay. Yes, I like that. You would expect number 2. Number 2 is expected. I'm not going to call the doctor about number 2. I will call the doctor about number 4, though. Yes. Okay. And so we have to be able to pick those out. And sometimes it's easy to just, click that distractor. Opioids will certainly help you to pick the right answer. So opioids is going to be a topic we're going to go over for ReMar Nurse University. I'm going to give you guys another question here. It says this. Oh, I like this question. Which of the following is correct when administering total parenteral nutrition to a client for the first time? Select all that apply. So we know TPN, right? We know access port for emergency. Number 3, TPN can be administered with normal saline to prevent dehydration. 4, TPN should be stopped before insulin administration to prevent rebound hypoglycemia. 5, oral foods are not needed as TPN achieves total nutritional support. Okay, this is a good one here. So what we're looking for is what is correct about TPN. What is correct about TPN? Because we've all heard about TPN. We've studied it, but do we really know it? Do we really know it like we should? Okay. And so this is why we come together every week, because just when you think you know a subject, ReMar writes a question about it. All right. So let's go over this topic. We're going to go over this for R&U as well. I'm really going to focus on a lot of the client education regarding TPN, but let's look at some of it right now. All right. So the correct answer here is, okay. Hey, only number 5. Only number 5 TPN. And so you don't start it. So you gradually initiate TPN. So, all right. 2, there are no access ports for TPN. TPN is a dedicated line. Do we put medications with TPN? Absolutely not. Am I going to be injecting anything into that TPN line? Nothing goes with TPN. You have a line here. I don't need an access port anywhere along that line because I am not injecting any ever. I have no reason to. All right. So no. 3, normal saline can be administered in the TPN. All right. Port to prevent dehydration. Nothing. Again, this is just another distractor. No, it sounds good, right? But we're not worried about our patient on TPN being dehydrated. Not at all. And we're certainly not going to put anything in the TPN port ever. All right. So this is basic safety. All right. Yes, when there's a select all that apply, you can only pick one. Absolutely. Yep. 4, TPN. Not too many people pick this one. 4, TPN should be stopped before insulin administration. All right. And so no. We don't want to do that, because with TPN is going to make the blood sugar elevated. So if we're giving insulin, then that blood sugar is going to go down. So we really need our patient to have some nutrition. All right. We really need our patient to have some nutrition. We don't want to stop their nutrition if we're going to give them insulin. And so that is just a basic safety procedure. Okay. All right. And then 5 is correct. 5 is correct. With TPN, one of the benefits of TPN is that you do not need to provide any oral foods. All right. A patient can completely get all of their nutrition from the TPN solution. So it is, it's a lot of benefits, but it's also a lot of risks when you're doing TPN. And the peripheral nutrition, that does not support all of your nutritional needs. So if a patient is getting PPN, then they will need to be supplemented. All right, with another form of nutrition. Okay, so we're going, again, during ReMar Nurse University, we have such a great opportunity to look at these subjects that we're familiar with and really dive deep into them, really talk about that administration, really talk about, the nursing education that's required. And so it's going to be a good time. It's going to be a great time. All right, one more question, and then I will move on. So this is the question here, and it's about something that you guys are familiar with as well. It is about platelets, okay? So it says, a new graduate nurse is preparing to initiate a patient, okay? So that means which statement is wrong, all right? Number 1, I must transfuse the platelets faster than whole blood. Is that right or wrong? 2, I should complete a type and cross before transfusions. 3, after receiving an order, I will make sure to use 2 client identifiers. Okay, is that right? Is that wrong? 4, after the transfusion is complete, I should flush the line with heparin sodium as ordered. Okay, as ordered. So we're looking for which of these statements regarding platelet transfusion is incorrect. Okay, and this is a tricky one. I know this is a tricky one. But just think about what you're given, okay? Think about what you're given here. This is different from blood, okay? When you have an order to give blood, you can be given whole blood. You can be given what? Plasma. You can just be giving platelets. What is the difference in the administration? As is in which one is wrong? Again, this is another topic we will be discussing. All right. So let me give you the correct answer. The sentence that requires follow-up education is this. Bam, is number 2. You do not need a type and cross match before transfusion of platelets, okay? Because you're not giving any red blood cells, all right? There's very few red blood cells. All right. So The other sentences are right, okay? The other sentences are right. When you give platelets, why do you have to give platelets faster than whole blood? Why do you want to give platelets in less than an hour? Does anybody know? What is the function of platelets? What are platelets going to do if they're sitting? What are platelets going to do? What do platelets do to our patients? If our patient gets cut and there's blood flow, what's platelets? So if we have a bag of platelets that need to be infused into a patient, do we want to wait hours and hours to get that formula, that solution into the patient? No, because it'll be all clotted. All right. That blood is going to clot. So we give platelets very quickly. We give it very quickly because that clotting time, oh my goodness, it's going to happen fast. All right. 3 says, of course, when you receive an order, you definitely need to use 2 client identifiers. All right. 2 client identifiers. All right. All right. And then 4, since. So we're statement requires follow-up education. All right. And so if you're familiar with the steps, or you're just familiar with platelets in general, if you understand what platelets are, then number 2, saying I need to do a type, cross, and match. Type, cross, and match are only for red blood cell types, okay? Not platelets. So again, it's just about taking your learning, taking your education to the next level, because really, these are all pharmacology. And I don't do this so that you guys can start freaking out like, oh, I thought I knew it. I jokingly, I present these questions to you guys as a way to just put you in the mindset that, hey, guess what? You're going to make mistakes. Absolutely. I want you guys to always leave with that understanding. All right. The person who makes the most mistakes has the potential to learn the most. You're not going to be perfect. Nobody is. And so I want you to take the stress off of yourself that you have to be perfect in order to pass NCLEX, because you don't. You don't. You have to be safe, not perfect. All right. And all of you guys are in that position to be safe nurses. Okay. So this kind of takes me, of course, to where all of my lectures are kept, where I put all of my new information. This is the virtual trainer. I have one for RN and PN for you guys that are just joining me today. If it's your first time, check out the virtual trainer. If you have not studied, if you have not ordered your VT, this is the opportunity for you guys to get it. Typically, your books will arrive in 2 to 4 business days, but you will get instant access to your platform. And so my LPNs, I tell you guys specifically, the standards for the test have changed beginning, all right? And this will happen until July, right? The minimum question, 60. So, but for my NCLEX PN test takers, the difficulty level of your exam has increased. It has increased. So I encourage you to please make every effort in order to be prepared. Don't just think that you can do questions. Don't just think that you can do practice questions. Really support yourself by getting the lectures and getting the explanation. All right, getting the lectures and getting the explanation. And right now we have dropped the price of the virtual trainer 75%. So right now the price is $149 for 90 days in the virtual trainer. But again, if you go to remarnurse.com, you will be able to get all that information. Okay. All right. And so my Monday motivation for you guys was simply this. And it is this live was perfect for it, because basically making the mistakes are better than faking the perfection. Okay. Making your mistakes is better than faking the perfection. And this is such a great principle, because when you are trying to prepare, when you're trying to prepare for NCLEX, and when you're in the virtual trainer studying, I literally see people, how can I say this? Not willing to try. All right. Really not willing to try. So you may have to take a VT test 20 times, right? But if you take it 20 times in 5 minutes, then what is happening and what you're saying is that it's not really like, I just want to get it right. Like, I don't want to sit through the mistakes. I don't want to research my mistakes. I just really want to get that passing score and move on. And so I just want to be a reminder to you and myself that when we're trying to learn something new, making the mistakes is part of the learning process. And I'm so glad you guys showed up today and were able to do those questions with me, because if you think that, you need to do a type, cross, and match before giving platelets, then that's a mistake that you were able to learn from today. Or if you feel like the client with the respiratory rate of 11 is a priority to the client who's unconscious, then that's a mistake. And so it's better to think about, okay, these mistakes that I'm making, how do I correct them? Then try to pretend like everything is perfect and you don't have any issues. And so, in nursing, we want to be perfect. We want to do everything perfect. But honestly, the best nurses are the ones who are able to self-evaluate and say, I have an area of weakness and I really, really want to fix it. I really, really, really want to fix it, because this is where learning takes place. This is where learning takes place. And so come to ReMar Nurse University, because the pharmacology lessons will really help you to understand the topic, and you won't have to fake perfection. You will actually know the information. So as we are preparing to go forward with our exams, some of you guys are testing this week. Some of you guys are testing next month as we close April, going into May. We have an opportunity to come together. If you guys are studying in May and testing in May, we have an opportunity to take on the subject of pharmacology while you're in the virtual trainer. If you have the Quick Facts book, get started, okay? Get started. The top 100 drugs, you do not have to Google them, all right? You don't have to Google them. Get in your pharmacology section and get started, okay? This will be a perfect jump start to you for ReMar Nurse University. And if you feel like, oh, I've been struggling studying Quick Facts, the pharmacology section, this will help. Definitely, this will help. So we're kicking off ReMar Nurse University. Let me show you guys again. Again, it is back. We will be giving you guys the best content, and I'm so looking forward to studying all of these different types of medications. The nervous system medications, the pain management, psychiatric medications. I'm really going to dissect the insulins and the oral antibiotics. Oh yes, blood products and medication administration in general. This is the free review, and it begins Monday, May 18th, and all the way through June the 8th. So literally it will be every Monday during this time frame. And absolutely most of the things that I do in ReMar, you guys know, sign up for it. It is totally free. I will be going live on Facebook. I will be going live on YouTube. All right. And this will be the perfect opportunity. Sign up for it. You don't want to miss out on this event. We only do this once a year. All right. We only do this once a year. So don't miss out on the opportunity for review for this topic because I've never done this before. Literally, you guys know when we usually do ReMar Nurse University, it's topics that I already have done in the past. And so I'm really challenging myself to present you guys new information about pharmacology. I'm really challenging myself to help make the virtual trainer. So this will be that opportunity, and I don't want you guys to miss it. So sign up for the difficulty level of the PN exam only is changing, not the RN during this time. All right. And so again, if you want to register, that is remarnurse.com/RNU. RNU. All right. So I will see you guys later. I'm so excited. I hope I can study with you all and we can continue to get our license. 2020 is our year. We always say this: I can, I will, and I must pass NCLEX.